Sometimes women or birthing parents and babies can become unwell after birth, but knowing the signs to look for and getting help early makes a quick recovery more likely. This video will begin by discussing the signs and symptoms you may experience if you are to become unwell. The symptoms experienced determine the level of care required. Some symptoms will be so severe that you will require an ambulance, though this is rare. Other symptoms will still require urgent care, and you will need to call your local 24/7 maternity unit as soon as possible. For most other symptoms, a call to your community midwife, the GP, or NHS 111 is more appropriate. Call 999 if you have shortness of breath or difficulty breathing, chest pain, fresh red vaginal bleeding that is gushing and cannot be controlled by a maternity pad, and you feel faint, dizzy, or feel that your heart is pounding. Try to stay calm and tell the operator you need an ambulance. They will advise you on what to do whilst you wait for help. Calling 999 is always free. Call your local 24/7 maternity unit if you experience vaginal bleeding that soaks a thick maternity pad in less than 2 hours, or the passing of blood clots, flu-like symptoms including a fever, so a temperature over 37.5, muscle pain or shivering, pain, redness or swelling in the legs, persistent or severe headaches, or blurred vision. Call your community midwife, GP, or NHS 111 if you experience any of the following: vaginal discharge with an unpleasant smell, abdominal pain that doesn't seem to be getting better, reddening and swelling of the breasts or any painful lumps from blocked milk ducts, pain when passing urine or difficulty emptying your bladder, difficulty getting to the toilet in time, diarrhea and sickness, signs of a wound infection. This could be from either a vaginal birth or caesarean section. Signs of infection include a temperature over 37.5, an unpleasant smell or increasing pain. In the first week after having a baby, many women and birthing parents experience low mood, irritability and anxiety, and may find themselves feeling emotional. These symptoms are normal, usually mild and only last for a few days, and are most likely caused by hormonal changes. This is commonly called baby blues. For approximately 1 in 10 women or birthing parents, these symptoms can worsen and last for a longer period of time. This could be a sign of postnatal depression. When someone has postnatal depression, they feel increasingly low, and caring for themselves or their baby may become overwhelming. The symptoms may begin in the first weeks after your baby is born, or can appear any time in the first year. If you experience any of the following signs, you may have postnatal depression, and we recommend that you speak to your midwife, GP, or health visitor. Feeling sad, low in mood, or tearful much of the time. Feeling agitated or irritable towards your partner, baby, or other children. Loss of interest in the world around you and no longer enjoying things that used to give you pleasure, like you can't be bothered. Lack of energy and feeling tired all the time. Trouble sleeping at night, even when your baby is sleeping. Problems concentrating and making decisions. Loss of appetite or comfort eating. Negative thoughts, such as feeling you are not a good enough parent, you are unable to look after your baby, or your baby does not love you. Feelings of guilt, hopelessness, and self-blame. Feeling anxious that something bad may happen to your baby. Or lastly, problems bonding with your baby, or no sense of enjoyment in being with them. These feelings may worsen over time without the right support, so it is important that healthcare professionals who will want to help and support you through this experience are involved early on. In some rare cases, it is necessary to call NHS 111 for immediate support. If you have frightening thoughts about hurting your baby, these can be very scary. But people with these kinds of thoughts rarely harm their baby. If you are thinking about suicide or self-harm, or if you develop unusual beliefs, delusions, or hallucinations, seeing or hearing things that aren't real, call 999 if you think there's a danger of immediate harm to yourself or others. You may have questions about your baby's birth or have strong emotions when thinking about it. If you would like to talk through your experience with a midwife, you can self-refer to the hospital's birth reflection service. If you would prefer to self-refer for support, you can do this via talking therapies. For more information and additional support, Mind and Pandas are both great resources. If you are worried about your mental health or your partner's, please remember there is no shame in asking for support, as every new parent needs help in different ways. Sometimes a very unwell baby requires an ambulance, as it is important they get to hospital as soon as possible. However, for most symptoms, a call to the community midwife, the GP, or NHS 111 is more appropriate. Call 999 if your baby is not breathing or is pale or blue, cannot be woken or is unresponsive, appears jittery or has jerking body movements, has a rash that does not fade when pressed with a glass, or has been badly injured. Try to stay calm and tell the operator you need an ambulance for a baby. They will advise you on what to do whilst you wait for help. Calling 999 is always free. Call NHS 111 to get prompt medical advice if you are worried your baby is showing any of these signs. A wheezing or grunting sound with almost every breath out. Breathing very quickly or sucking in their tummy just below their ribs when they breathe in. Blue nails. This can be difficult to see if your baby has darker skin. Unusually sleepy or drowsy, irritable and not wanting to be touched, not feeding well. Yellowing of the skin, gums or whites of the eyes. It might be easier to check the whites of the eyes or the skin on the palms of the hands or soles of the feet if your baby has a darker skin tone. Dry nappies or pale poo, a temperature above 38 or below 36.5. Projectile vomiting or vomiting that is green, brown or blood-stained. Diarrhea. A bulging soft spot at the top of the baby's head. Stiff or floppy body, turning away from bright lights. Pale or blotchy skin. You know your baby best, so if you have any concerns about their health, never hesitate to call for help.